This conference will now be recorded.
Okay, great. So now we're recording. Welcome everyone. If you missed the beginning or anything like that, it's fine. I'm gonna get this uploaded somehow, some way. I am brown, so I'm good inherently at IT, so I'll be able to figure out how to get the link up to YouTube or whatever platform, probably YouTube, and I'll share that link on my Twitter account, which is at Dr. Harris Lakers.
Yeah.
Shehzad is here also, so all the presenters are here. Okay. And if you're not speaking, then please mute yourself. I'll try to mute people as I see their mics are on. Okay, mute. So we have 130 people here. Oops, right now. Don't worry. I think I'm surprising some of the presenters that that I didn't tell them that this will be recorded. So you look at me. I didn't shave or get a fresh haircut either. But so basically, you know, we're going to be talking to you guys about matching into surgical subspecialties as a DO. It can be an intimidating topic for some, but there's no need to be intimidated. You all are capable and you all will match. We're going to have a part 2 that comes pretty soon. We have a CT surgeon who wants to help, a neurosurgeon, and we also have plastic surgery. So neurosurgery, plastic surgery, CT surgery are coming soon. Maybe in the next month or so, we'll have that. And then this is very laid back. You know, we don't have, some of us have presentations like some PowerPoint slides, but for the most part, we'll just be kind of talking to you. We're going to introduce ourselves. Then we're going to give some general advice and tips, you know, based on our experience. And I'll let the presenters introduce themselves as they come on. And then the majority of it will be a Q&A. So in the chat box, you can just put in your questions. And then just remember, this is, ENT is represented. Today we have ENT, ophthalmology, orthopedic surgery, urology, and thoracic surgery, or sorry, vascular surgery. So that's what we have today. But the thing is, you can get lessons from all of us, even if you're not going into ENT or you're going into opto. A lot of these principles will apply to everything. But you know, so N equals 6. You're getting 6 people's opinions and experiences. It's subjective. So just consider that. You know, take what you can from what we say and dump what doesn't apply to you. And hopefully you can learn something from our experiences. And just for some background, this is post single accreditation. That's the era we're in right now. For those of you who are unaware, what that means is before 2014, there used to be 2 separate residency systems. One was the ACGME. They accredited a set of residency programs. And then the AOA, they accredited a set of residency programs. And what happened is we merged residencies so that now all residencies are accredited by one system, the ACGME. It's been hugely advantageous to us. One reason why it's advantageous is before, let's say you're in 2013 and you want to do ophthalmology, or let's say orthopedic surgery, before you would have to decide, am I going to apply ACGME and take the risk, or am I going to go the quote unquote safe route and apply AOA programs? And it was a decision you had to make, because if you decided that you were going to apply ACGME versus AOA, they were on different timelines and they were separate apps. So if you applied as a quote unquote safety to AOA programs and you matched, you would automatically get pulled from the ACGME match. Now you can apply to every program at the same time. You can apply to historic ACGME programs and historically AOA programs at the same time. That's one huge benefit. Another benefit is we have record placement and match rates in NRMP now. We used to be 78 to 80% match rate in NRMP, and now we're 89%, 90%, 91%. So our match rates have gone up. Placement rate is over 99%. And most importantly, we're matching at new places. A lot of the presenters here, they're one of few or the first ever DO at their respective program. So, you know, just some things to consider. Also, there's a website. If you go to apps.acgme, you can find a database, and I'll tweet this out also, that you can put in a specialty that you're interested in, and you can figure out which former AOA programs are now ACGME. And it's helpful because if you want to know which programs used to take DOs, you may think they have a preference for DOs still, and some of them do. You can find those programs out, and you can click, you know, ENT or plastic surgery or neurosurgery, and you can see, okay, there are 5 programs or 10 programs that have now transitioned from ALA to ACGME, and you can see if they say initial accreditation or continued accreditation, that means that they're eligible to take applicants. If it says pre-accreditation, then they are not actively taking applicants. So it has to say initial accreditation or continued. And I'll send the link out. It's apps. I'll actually post a link right here in this thing, and I'll also tweet this link out along with the recording. So that I think is a high yield resource. I think I sent it to one person on accident here. That's something that I think everyone should look at to see, you know, these are the former programs. But you should also know that just because they're former AOA programs, it doesn't mean that they're exclusively taking DOs. What's happening now is there are programs that are historically MD that are taking DOs for the first time, and there are historically DO programs that are taking MDs for the first time. And that was the intention of the single accreditation process. Another quick point, don't get too hung up on NRMP match data. It's important because we like big data, but we're a very small sample size, especially those of us that apply to surgical subspecialties. DOs were very small, so what you'll see is 1 year for orthopedic surgery or for dermatology or whatever, you'll see a 40% match rate, then you'll see a 20%, then you'll see a 55%. You'll see these wild fluctuations, and it's hard to get too much information from that. So don't put too much into those NRMP match data stats for us. Other thing I wanted to say, and I'm sure it's going to come up, USMLE going past Phil. It's not great, but it's okay because step 2 CK is still there, and it just emphasizes the need to do these intangible things like networking. And so with that, I'm just going to give my last few tips here, and then I'm going to give it to the next presenter to give their tips. And my tips are, do the maximum amount of OAs. I did 4 OA rotations, so do as many as your school will allow, and even push them to give you more. And then try to attend virtual grand rounds or in-person grand rounds at the nearest department that's nearest to you. For me, University of Arizona Ophthalmology was the nearest ophthalmology program. I attended their grand rounds whenever I could. I got a letter of recommendation, research, and networking out of that. And also utilize social media with sincerity. Don't slide into DMs and be weird. Be sincere, have meaningful dialogue with people, and talk to them, and you'll get networking and researching from there, because these are the things that is hard for a DO. It's hard for a DO to network and overcome the lack of, department access and things like that. We don't have the big sexy departments with 50 million faculty and research projects, so we have to kind of hustle for those things. So social media, attending local grand rounds, those are ways to do that. And lastly, what I'll say is don't just target, in my opinion, again, this is my opinion, don't target programs that are just former DO programs and think, or that have had DOs and think that, that's the basis of which you're going to decide which program to go to. A lot of us we were the first DOs to match at our program. So, if we had just listened to other people and avoided certain programs, we wouldn't have matched there. And so don't just say, oh, I'm going to look at this website and I'm going to see, oh, this person, they took a DO 50 years ago, or this person has a DO faculty, or this person has a DO fellow. Don't forget that. Don't use that as a metric. Go to new places. It's an exciting time. Single accreditation. People are excited to take DOs. We're like a new commodity for these people. So don't count yourself out. Don't self-select out. And someone has asked a question here. What are grand rounds? Grand rounds is when a department meets once a week or once a month, and they go over some cases, and they have a discussion about the cases, or they go over some research. And if you go to if you're interested in, for example, Loma Linda Ophthalmology grand rounds, you just Google that, or University or UCLA grand rounds, orthopedic surgery, you just Google it. You find out what time and place they're at. If they're in person, you go when that time is. If they're virtual, you ask them for the link. And I think so with that, Jesse and Temi are gonna join via phone, and Shehzad is also gonna be joined via phone, because I think they're having some issues with lag. So before we get into these questions and answers, I'm gonna give it over to Gabby, who's gonna go ahead and talk about her experience, introduce herself, and all that good stuff. So you're a presenter now. I'm gonna mute myself.
Hi, can everybody hear me? Good, okay. My name's Gabby. I go to PCOM. We'll be graduating soon, so very excited about that. It's awesome to see all these DOs here. It looks like we have people all the way from first years to fourth years, which is great. So I matched urology this year and I'm thrilled. I matched at MUSC, which is in Charleston, and I'm the first DO to have matched to their residency program. So I understand a lot of the fear in applying to subsurgical specialties as a DO. But let me just share my screen. Oh, actually, I think, Harris, it needs you to do it. We planned for this, don't worry.
I'm gonna pull up your slides and then I'll put them up here, and then you just tell me when you want me to go to the next one.
Awesome, thank you.
All right. You guys can't see my screen right now, right? Okay, so I'm gonna share my screen also once I get this open. I don't have anything embarrassing on my screen that I need to hide. Okay.
While he's getting that up, for those of you who are, you know, in like the first, second, or maybe third year, definitely like a lot of these fields are something that you might not, like, you know, ophtho, for example, ENT, urology is something that you might not always get exposure to. So highly recommend, if you're interested in something surgical, to check out a lot of these fields, because it might be something that you're not given exposure to through your school, but is absolutely something that's, you know, worth the risk to do a rotation in. So this is my information. Seriously, feel free. I'm literally on like medical Spanish for this month, and next month I'm on a vacation month. So if you want mentorship or you have questions, please feel free to email me. That's my Twitter as well. And we can go to the next slide. All right. So this is the 2021 match stats. It's getting a little cut off, but basically it shows that the average step scores and the average number of publications and posters. Just because you do not have those specific step scores or those specific number of publications does not mean you will not match. For the step 1 score, I can tell you that I was definitely below the average. And I still matched at my #1 program, so it's still obviously possible. I think for those of you who are in the later stages of your career, if you've already taken step 1, you know, rocking step 2 is, you know, just a really good way to bolster your application, and really getting involved in research and showing that you're interested in being really present on those interviews and being able to talk knowledgeably about the research and show passion about your research is definitely something that will really go a long way. If we can go to the next slide. I don't think it's sharing anymore.
It's not sharing. Let me see. Go back. Can you see it now?
Yeah, perfect. Oh, there we go. Okay, perfect. So I compiled this from the urology Google sheet, which is like one of those sheets that all of the specialty has. Pros and cons to doing those, but that's, you know, a conversation for another day. But so this may or may not have all of the data. As for what it looks like based on what the AUA reported and what's on the Google sheet, it looks like about 45 DOs applied this year for urology, and 22 DOs matched, which is huge. That's almost a 50% match rate, which for DOs is, I mean, awesome. And this is like the most DOs that have really ever matched urology. And as you can see, 7 students were the first students to match at historically MD programs, which is awesome. So the future is looking extremely bright for DOs, and I think that this is just super encouraging for going forward. The next slide. Just some basics, because I didn't know this, if these are more geared towards like third years. You apply for residency through ERAS, but you still need to apply through the AUA to do the urology registration. So that's $75, and even if you have an AUA ID already, because you're a member, you still have to pay the $75, and that's to make sure that you can rank. You'll also pay if you were, you know, applying general surgery, for example, as a backup. You would also pay money through the NRMP, which is a different ranking system for everywhere else. And the 2022 deadlines haven't been released yet, but this was about what it was for the 2021. You can check that out on the AUA website. Next slide. So as far as tips, I think that my biggest recommendation to you is to be active, be enthusiastic, and be passionate. So like Harris said, go to didactics. I went to didactics for like 10 different programs, and I would go every single week, and I would try really hard to, you know, if they wanted us to be engaged, I would absolutely be engaged. If other students weren't talking, then, you know, just kind of gauge the feel and do what you need to do. Asked to do grand rounds presentations. So you can make a, you know, I picked a topic that was something that was unique in urology, and it was on infertility in urology and a specific new type of research that was being found in urology. When I gave that presentation, I actually was able to teach the residents and attendings things. If you're able to do that and you don't give just a cookie cutter normal med student presentation, they will remember you, and that will definitely go a long way. You know, for programs that you're interested in, aside from emailing them and asking if you can go to their virtual didactics, ask about ways that you can get involved with case reports or research. Obviously, you don't want to inundate yourself and have a million research projects and then do a crappy job. But if you can show them that you can do a case report in a timely manner, or you can help with research and be really effective and meet your goals each week, then that's what they are looking for in a resident. They're looking for someone who can, you know, do what they're told and exceed expectations. Something that I did, which I think worked really well for me, is for a few of the top programs, I actually, before applications were due, I asked to Zoom with the PD, which is the program director or residency director, because for our year, we weren't able to rotate. The AUA said that we were only allowed to rotate at one program, and it had to be our home program because of COVID. So if you can't rotate somewhere and you feel like going to didactics isn't enough, then absolutely email the PD, see if they'll be willing to do a phone call, see if you, you know, if there's anything that you can do to increase your odds at getting an interview at that program. This year, urology was awesome, and I'm sure this will continue. They had a ton of virtual rotations since we weren't able to do in-person rotations. If that, you know, I'm pretty sure that's going to continue this year as well, since we're not quite over the COVID hump. Look on VSAS, Google virtual rotations, and on the next website, I'll show you some other resources as well for where you can find virtual rotations, but that's huge. If you do virtual rotations, it's just like, you know, your normal rotations. You show up, you come prepared, and you be really involved. And I think doing all of these things is huge. The last piece that I would say is, if you're a third year, start working on your personal statement now, and that way you can get a lot of eyes on it. So what started as my personal statement to my final product of my personal statement was completely different. So I would definitely start thinking about that now. And then my last slide, I think that it sounds really dumb, but Twitter also proved to be huge in my application cycle. I remember very vividly in one of my interviews, the chairman said, I saw on Saturday you did a virtual presentation at this specific conference, and I, like, you know, watched that presentation. So that's huge that he saw that because of my Twitter. So definitely follow these specific urology resources on Twitter. As well, these two websites that I put are give a lot of good data about how to match, where different places are offering research, where places are offering virtual rotations. And like I said, feel free to email me. I can drop it in the inbox as well, but really happy to help. I think that DOs have a really bright future, and, you know, we're all going to do well. So keep encouraging each other. You're all going to do great.
Thank you, Gabby. And before I get Temi on here, here's the website that I was telling you about earlier. I don't know if you can still see it or not. Let's see. Options. Can you guys see this website that I'm showing, or? I think it says screen share.
No, it's still on screen share from Gabby's.
Okay, let's see if I can. Dude, I feel like I'm 80 years old right now that I can't even figure this out. All right, let's stop screen sharing. Okay. Can you see this?
Yeah, we got it.
Okay, great. So this is the website I was telling you about, where you go to this database and you look at what specialty you're interested in. You know, if you're interested in clinical informatics, which is apparently a pathology fellowship, or whatever. Obviously, you guys are going to be into these: orthopedic surgery, ophthalmology, and let's click on ophthalmology here, which is my field. You go to view report, and it's going to give you this report, and you'll see here you have a list of programs that you can see that are former DO programs that are now ACGME accredited. If it says continued or initial, you're good. If it says pre-accreditation, then they're not taking applicants. So these are the programs you want to reach out to, outside of, all those different application services. You want to reach out to them directly for research, for away rotations, to meet their faculty, things like that. Okay, so now I'm going to see if Temi is here. I see him coming in and out. And I'm going to make him, and then remember, after we're done presenting, the presenters talking about their experiences, then we're going to answer all of your Q&A questions. And I think Temi is answering some of them as we go. Let's see if I can find Temi. And if I cannot find Temi, I will go to Jesse. And then, let's see.
Hey, I'm on here on my phone, but I'm not sure how to be found. Can you hear me talking?
Yeah, I can hear you, Temi. Do you want to go from your phone?
Yeah, that's cool.
But no one can see your handsome face. It's going to be upsetting, but it's okay, I guess.
It's all good. Hey, everybody. So my name is Temi. Sorry, there's some technical difficulties. I'm working through that right now. But I'm a fourth year med student at Baruch College in New Mexico. I just matched orthopedic surgery at the University of Washington here in Seattle. So me and Harris were kind of classmates. We came into med school together, brand new DO school, and it's just nice to see, our journey and to see Harris on this platform. So I appreciate the invite, brother. So, my story, I don't have a PowerPoint to share, so I'm just going to talk to you guys briefly and kind of about my journey. So I kind of wanted to do orthopedics beginning in college. My roommate tore his ACL during college, and I got a chance to actually watch that case as a 19-year-old. So I watched in the background. And this kid actually got drafted to play in college, or the CFL a few years later. So my team physician was a DO at the time, and he kind of just chose me. This path kind of chose me. So because of those interactions, I chose to venture in the osteopathic world. So just a little bit of a background. I did not have a strong MCAT score when I was applying, and I didn't really know any other orthopedic surgeons. But because I met this physician in college, it just showed me the platform, and I thought, why not? If he can do this, why can't I? So push comes to shove, I applied to a bunch of MD and DO schools. Only got into 2 osteopathic medical schools, and Burrell was one of them. I remember interviewing for medical school, and there was no building when we were interviewing. We interviewed at the New Mexico State Aggie football facility. So I kind of took a bet on myself, and it worked in. So my goal was to get into an academic residency. Burrell had a medical or ortho residency at the time, affiliated with the medical school. But due to the ACGME merger, that program actually shut down. So that actually caused me to kind of go into a little bit of a panic. That same summer, I got my step 1 score report back, and I wasn't ortho competitive. I was actually quite a few points below that. So that kind of led me to a little bit of a cluster. So what I did from that moment is, I didn't give up. I had this goal of becoming an orthopedic surgeon. I don't have a strong step 1 score, and I go to a DO school, but it seemed like there was a bunch of chaos going on around me. So one thing that I did do is I took a year off to do research. So I did a research fellowship at the University of Minnesota, and that kind of changed the landscape for me. What I learned quickly was my research year was about research, but it was more so about the importance of networking and having people know who you are. There's going to be a lot of third years on this call that they're doing clinical rotations in rural places, and you guys are applying to programs, and sometimes these community letters that we get don't really hold much weight. So I was fortunate enough to have a lot of mentors that kind of told me, you're entering a world where you're going to be viewed with a bunch of ND applicants, especially for orthopedic surgery. You need to have an MD caliber application. So that was one thing that my research year got me, was mentors, traditionally MD mentors that, kind of fought for my application. So as Harris pushed this along, as in my 4th year, my school let me do a ton of away rotations. So I did 5 orthopedic away rotations. One at a community program. I went to an Army Medical Center who has a history of taking DOs. I went to 2 academic centers. One has DOs, and then the other one did it in Minnesota. So the biggest thing that I can tell you guys is do not self-select yourself out of this process. chances are, if you do it away somewhere and you get the away reputations, all you have to do is show up and be someone that people would like to work with, bust your butt, and you will get an interview. It could be at Harvard. I went to Mayo Clinic for a month, and I thought I had no chance, but my mentor was like, you're just limiting yourself out of any opportunity. So I applied, and I got the away rotation. So that's something I'll tell back on is, if you have a dream location, UCLA, if it's a big program, like I advise you to just take a risk on it and just do a rotation. That chances are you come in, bust your butt, and you will get an interview. So like I said, do multiple away rotations. And, I'm at the University of Washington, and I think back on this journey. And another advice for you guys on the call is to go to conferences, network, and get yourself out there. I went to SNMA conference, which is Student National Medical Association. And just by chance, I met the chairman at the program that I matched at as a second-year med student, and he was there with one of his residents. And I didn't think too much of that interaction. I got his number and I emailed him a few times. And, we just kind of kept that long-lasting relationship. And 2 out of my letter writers from my research year, they went to fellowship in Minnesota, and one of them went to med school with the program director. So I'm just letting you guys know that this is the importance of just having a network, having a team of people around you. We've talked about Med Twitter. Without Harris, I would not have been on that platform. And, I actually got 3 interviews from Med Twitter just by, I was very strategic. I made my Med Twitter summer of 4th year. Like I said, you want people to know who you are when you're applying for residency. That's the most important. That's the most important thing is by October of residency application, you need to be known. So Med Twitter gives us that platform. You have to be able to adapt to this era. I've talked to a bunch of students this last week. It's just been kind of crazy. And there are 250-years, 260-years, 270-years that are not matching because no one knows who they are. So that's my challenge for us as osteopathics is, you'll get something from everybody on this platform, but do not self-select yourself out. Have big dreams. I remember when I was 19, I saw this osteopathic physician do an ACL on my roommate, and I knew from that day forward that I was going to be an orthopedic surgeon. No one could tell me that I could not. I wish you guys could see the look on my face. I have something on my wall is have big dreams. From that moment on, I knew that I was going to be an orthopedic surgeon. It doesn't matter if you don't have a 250 step 1 score. It doesn't matter if you go to the DO school. I didn't have AOA at my program. I didn't have a home program. So, there were so many, I didn't even honor surgery. So there were so many things that if I would have given into the cheese, as they say, and I let people guide and direct my future, I wouldn't be here. So that's it. I feel like I'm rambling for a little bit, but for all of you medical students on the call, believe in yourself. The sky's the limit. Just because you're in a DO means that it will be a little harder, but it's not impossible. And you have 6 amazing physicians, colleagues, mentors on this call that are all a testament to that. I'm fortunate to get my match. I'm the 2nd DO in the program. And, I'm happy to talk anytime to anybody that wants to reach out to me. I'll type my email and my Twitter handle in this chat. If any of you guys want to talk a little bit more, but that's all I've got for you guys, and I'll hand over the mic to Harris.
Thank you, Temi. That's a great example of doing that research year, the value you can get from that, becoming a known commodity, becoming a household name in your field. And so now next we'll have Paul. Paul, you can go ahead and unmute yourself. I think you're already presenting, and go right ahead. If for those of you who can't see his image, I want you to know that he looks like Superman.
Thank you for that sparkling endorsement there, Harris. Harris and I go way back to 1st year of med school together, met at conference, and we've been in touch. He's been an awesome guy to go through all this stuff with. So he's a really valuable resource. He cares about you guys a lot. He cares about the future of the DO profession a lot. And, I highly recommend listen to every word out of that man's mouth because it's gold. But in any case, so a little bit about my journey. I also do not have a presentation. I apologize for that. I'm on a very busy ICU rotation at the moment. But so I'm one of the ENT interns up at Rutgers, New Jersey Medical School. And my program is a little bit interesting in that it's traditionally an MD program, and they absorbed a previous DO program at a nearby hospital called St. Barnabas. So my program was pretty staunchly MD. In fact, I when I rotated here as a med student, the clinical director, for the clerkship, it was myself and 3 MD students, and we were all sitting in his office. And the very first thing he says is, so I'm sure you guys heard that we absorbed a DO program this year. I just want to let you guys know we're probably not taking any DOs this year. So yeah, we're going back to being all MD program. And then he looks around and he goes like, wait, none of you are DOs, right? And I kind of sheepishly raised my hand. I was like, yeah, I am. And he goes, oh, okay, well, you get it, right? And I'm like, I didn't know what to say. So in any case, I kind of just like, bit my tongue a little bit, and I was like, all right, whatever, I'm just going to make the best of it. And this was actually my first away rotation. And, I just made sure that I made a point to, the first thing is you got to be there on time every day, of course. And you have to show that you're a dependable person. So if a resident asks you to do something, you go above and beyond, you do it. If you see that there's a need that you can foresee on your away rotations, it'll make you look incredible. If you just anticipate the need, take care of it for the resident, as long as it's not, stepping outside of your boundary or compromising patient safety or anything like that. And you want to make sure that you're just pleasant to work with, pleasant to get along with, you're knowledgeable, you read up about the cases the night before. These are all like the standard things you should be doing on away rotations. And just remember that, on away rotations, it's very easy to shoot yourself in the foot. So I don't want you to say that to make you think about like, stepping on eggshells or anything, but it's just something to keep in mind. Keep in mind how you're presenting yourself. And in any case, the away rotation ended up going very, very well. I got 2 letters of recommendation, one from the chair, one from the director of Otology. And I think that really helped me when it came time to interview. And believe it or not, what's very funny is that even though it had gone from this very anti-DO kind of sentiment at the beginning of the year, they ended up taking 2 of us last year out of a total of 4. So that was kind of a big surprise, and we were pretty happy about that. But the year previous to that, they hadn't taken any, and this year we didn't end up matching any DOs. But I do know that we interviewed DOs this year. So, I think it's not a matter of them being anti-DO, obviously, as they've taken multiple of us now. But I think it's important to remember that even if, don't be discouraged, even if things don't turn out your way, or even if you don't see a DO necessarily that gets taken a certain year, that program might still be open to them, and it could have just been how the match worked out. So some of the things I did to make myself competitive during medical school, number one is, I set myself up well with a high step 1 score. I know for you guys, it's going to be changing a little bit. So Harris was mentioning, the step 2 score is going to be big, but I think that really, as others have said, is going to highlight the importance of networking, doing well on your away rotations, trying to get in research wherever you can, because, at a certain point, you're looking to enter small fields where everybody knows each other and where everybody kind of looks the same on paper, like everybody's going to have high step scores. Everybody's going to have good grades. Obviously there are going to be a few that don't still get in, but, the vast majority of applicants are going to have these things. And then they're also going to be coming from big schools with big names and things. So whatever you can do to network, get out there to conferences, go to didactics, do research, med Twitter, all these things are a really good way to kind of get your name out there and separate you from the pack a little bit and get seen as, oh, this is, so-and-so, not, oh, this is another medical student with a high step 2 score and great grades, Other than that, as far as ENT goes, it's a very strange field. We don't get a lot of exposure to it in medical school, and for me personally, it was something where I just started getting a little bit interested in it when we were learning about the senses, and I did an elective in it, and I think that is a great way to see whether it's something that you'd want to do for a career or not. Is if you can do an elective in a field that you might not have as much exposure to, that's probably the best way. Yeah, I just went for it. And, you know, there's going to be a lot of advice as to whether you do a backup specialty or not. My advice, and this is going to vary from person to person, so do not, do this and say, Paul, that resident told me, don't apply to a backup. But my advice is don't apply to a backup. If you're convinced you want to go into a field, throw all your eggs into that basket. And if you don't match, but you're still sure that that's what you want to do, and you're decently competitive for it, take a year off, research, make your application better, and apply again. I think you're all in an amazing position. There have been a lot of amazing, DOs who've come before us that have blazed trails. We're trying to keep that alive too, and we're eager for you guys to get there too, and open up the fields even more for everybody else who comes after you as well. So I don't know. Well, that's kind of all I've got to say.
Thank you, Paul. That's another great point is don't get disheartened by statements you hear, rumors you hear that this place is anti-DO or this place will never take a DO or this or that. I used to hear those things as well when I was on my journey, and what I did is I ignored them, and that helped me a lot. Is just ignoring the negativity. Also, someone asked about military match, and I think that's a really important question, matching into these surgical fields for the military. And so what I'm going to do is for part 2, when we do neurosurgery and we have CT surgery and we have plastic surgery, I'm going to see if we can get someone from the military also, because that's a really important topic. And so we'll address that in the future. Lastly, before we go to Jesse, is there's Med Twitter, there's Instagram, and there's also a new app called Clubhouse. And I think you should all be on Clubhouse also. If you don't have an iPhone, why don't you have an iPhone? And number 2, you won't be able to use that app yet, but hopefully it'll come out to the other phones as well. And that's a good app where you can have kind of these very intimate discussions with thought leaders within your field. So do that. And before we go to Jesse, I'll tell you the power of Med Twitter. Someone asked in the chat about Dr. Carmody. Me and him have done 3 publications, 2 podcasts, and we have more stuff coming. And we've never met each other. We've only known each other through Med Twitter. And the way we got introduced is me and him had a very aggressive back and forth disagreement on USMLE going pass fail, and he was for it and I was against it, and from that we developed a relationship. So that's a case example of the good things that can happen from using Twitter and Instagram and these kind of things. So Jesse, go ahead, if you could unmute yourself and speak.
Hey guys, what's going on? I look horrible. I've been on for 3 weeks straight, so my apologies. Just an introduction. I'm the vascular surgery intern at Mayo Clinic in Rochester, Minnesota. Thanks to Harris for inviting me. Thanks to all you for being here. I agree with kind of everything everyone said, so I'll try to give a different perspective or kind of fill holes there I feel like they could be filled. I think it goes without being said, being attentive, being honest, being hardworking, showing up at conferences, etc., is all very important. One thing I was frustrated with when I talked to a lot of people who matched well or matched in vascular, they would never tell me their numbers, and I'm just all about transparency. So I'll just kind of give you a lowdown of what my deal was. Obviously, when I took step 1, it was still numerical. So I got a 265 on step 1. I got a 260 on step 2. I took a year off, did research, and had around 15 publications at the time of applying. So just to kind of give you a baseline of where I was in terms of applying. I don't think anyone's mentioned this, and I think there's just by the questions that have been asked and the comments that have been made on the chat, it seems there's a lot of first and second year med students here, and that's fantastic. I think it's good to get your feet wet early and figure out what you need to do, but make sure you're actually interested in the field that you're going into, especially as DOs. It's hard to get exposed to the actual field. Sometimes you see things on Twitter or YouTube or you read about them, but you don't really know until you're living that life. So just make sure you're actually interested in what you're doing and you're dedicated to going through that training and living that life as an attending, because I think it's very different than just kind of consuming it. So make sure you're interested and there's many ways you can do that. I would say reach out to people local. If you can get into any OR, any type of OR you can get into, whether it's academic with residents or not, and see what the life is like and the actual surgeries you do and the lifestyle you have. Because I think everyone loves, for example, for vascular, everyone loves a carotid endarterectomy. I think it's one of the most elegant procedures in all of medicine, but you're not doing carotids every day. So make sure you're happy doing the nasty stuff, the feet, the infected aortas. I'm sure every field has kind of its bread and butter that no one loves, and make sure you love the bread and butter, because you're not going to be doing the super cool, sexy thing every single day of your life. I think that's important to remember. I think a lot of people touched on going didactics and conferences. I actually didn't do that very much. I only really did that on my sub-Is. There really wasn't many opportunities for me to do that, and I didn't really seek them out. But one thing I did do was take a year off and do research. I think Temi mentioned that he did that as part of a separate program outside of his med school. I know my DO school had it. I went to NYIT in New York. That's where I'm from. I know a lot of other DO schools have this, like usually like 1 year research fellowship or 1 year kind of medical education year. My school had that, and I did that. And it was fully funded, which is great. And I worked on campus 40 to 50 hours a week. But then all my off time I essentially spent doing research. And I want to talk a little more about research because I think it's important. I think that's probably what got me where I am now. Is find a mentor that's a research reliable. When I say research reliable, make sure it's someone that publishes a lot, that has data for you, that has an infrastructure for you, and that's going to give you appropriate authorship. I have a lot of people that reach out to me and say, oh, I'm interested in working with so-and-so, and then things fall through the cracks, or they do all this work and then they get like middle authorship, even though they probably should have got first authorship. So one of the things I highly recommend is make sure you're going and working with the right people and be selective. I know it's hard to be picky as a DO. We feel like you got to take any scrap that you can get, but if you go in with that attitude, you kind of might get screwed over. So make sure you're being selective. And if you choose to do a research year, I think Temi made the right move in going somewhere that was established. Don't just take the first offer you get. And if you're not in a populated area or a place where you feel you're going to get the opportunity, figure out, do I have friends or family, or do I have the financial means to live in another area? And see if you can do that. I was fortunate enough to live in New York, and a lot of my stuff was based in New York City, so it worked out nicely, but I know that can be difficult for other people. And now recently, I think a lot more people are getting involved with research over the internet, so you can also do that. And again, the year off is big, but you need to set it up properly. You can't just say, hey, I'm taking a year off, and then January 1st or whatever, August 1st comes around, and you're like, oh, hey, let me figure something out. Like, have your ducks in a row at least 6 months before, and have a backup too. In terms of sub-Is, branch out, go across the country, do something different. Don't stay in your local area unless you have to, unless you're family tied or you have some issues. I'm from New York. I'm born and raised in New York. I love the city. It's the best place in the world. But I did a sub-I in New Orleans. I did a sub-I here at Mayo, and then I did a sub-I back in New York. And guess what? I didn't rank a single New York program. Just not where I wanted to train, not the kind of environment I wanted to be in. I fell in love with Mayo. I hate the Midwest. I don't really like it here. The food sucks. The people are weird. There's too many Trump signs everywhere. But I love Mayo, and that's what's important. And I know I'm going to get a good education here, and I love it here already. I'm tired as all hell, but I love going to work every day. Especially if you're in this chat, you're obviously interested in the surgical subspecialty, and unless you're finding the most cush program in the country, you're going to be working a lot. So I think location matters less than you think, and keep that as a reminder, unless of course you have family or other commitments, and that's obviously important. For applications, it's expensive and it sucks, but don't apply places you have no interest in going to. And I think that's really big, because you'll get desperate and then start interviewing at places you have no interest in. And if you end up matching there, you'll be miserable, and your career is going to be long. And if you don't match, a year is a year. I took a year off and did research and don't regret it one bit. And I told myself I didn't match vascular. I didn't apply general surgery as a backup. I know Paul mentioned backup. I didn't do that either, because I can't envision myself doing hernias and gall bags. It's just not what I wanted to do. So if taking a year off is possible, consider that. If you don't match, try again, do something else to make yourself more competitive. But dual applying is really logistically difficult. You have to do multiple sub-Is and multiple specialties, get multiple letters. And I know people from my vascular interview trail that interviewed general surgery as well, and it shows. The general surgery people aren't stupid. They know if you're applying vascular or plastics or CT, they're going to see it in your application. They're going to see all your letters, all your research, all your conferences. So be aware of that. And the last thing I was going to say, and I think it's been harped on before, but it's super important, especially vascular, such a small field, is everyone knows everyone. So just get your face out there. I've never heard of this whole visiting didactics over the internet thing, but if that's what's going on now, then by all means do it. I went to every conference I could. I would, find cheap flights, crash in hotels with other people, but I got to know the same people over and over again. And then I would see them on interviews and say, hey, I remember you gave this talk. And the talk was horrible, and it was some garbage retrospective single center research thing that no one's ever going to read again. But it doesn't matter. I went up there and I was enthusiastic and I was interested, and that's what mattered. And the last thing I'll share with you, and I think this goes for everyone, no matter what you're applying, is every single line on your application, you need to know front and back. So if you somehow got on some research project where you were the middle, fourth, fifth author, and someone just threw you on as a favor because you put them on as on another paper, which happens all the time, and that's fine. It's how it works. But know everything on your application, because people will ask you about it and they will call you out, and you will get DNR'd if you don't know everything about your application. Because at the end of the day, a lot of these surgical specialties, they'll have applicants who have, ERAS applications that are 30 pages long, and you'll get called out. There was an interviewer at a program that I went to, and she asked me, I knew she asked me about a research project that she thought I didn't know anything about. And she was like, what would you do to improve this project? So not only do you need to know what the results were and what the project was and somewhere it was presented, but like be able to talk about anything. And I think that's what really set me apart in interviews, is someone would ask me about research, and then I would ask them a question back. I said, hey, this is what we found. What's your opinion on this trial? Or what's your opinion on this? And I tried to have a conversation with them during the application and interview process that made it seem like I was already a resident in their program. And I feel like that really works. Don't cater to them. Don't just suck up to them. Make it seem like you're a resident, you're already a trainee, and they're picturing you sitting in their OR, you're sitting in their office, you're sitting in their didactic. And I think that's what matters. Is it's not always about you catering to the program. It's about the program catering to you and making it a good fit. I think that's what really matters. And I'll drop my email in the chat and my Twitter handle, and I'd be happy to speak to any of you on your thoughts and your individual needs and what I can do to help you kind of realize what works best for you. Thanks for the time.
Thank you, Jesse. A lot of good points. Being unique, having something unique, like for Jesse, it was research. For me, I had a lot of health policy work. So one thing that's advantageous to you is in an interview setting, if you have something unique that you are an expert on, the power dynamics of the interview switch, and now you're the expert. So when I was having my interviews and a policy topic would come up or advocacy, I most often was the one with the most experience on that topic. So then the power dynamics switched. I became the most well-versed person on a given topic, and that's a nice element to have within an interview. So for that portion of the interview, I became kind of the expert, and for Jesse, he became the expert on those research topics. And also, it could be something fun, like if you're a musician or something, or you have a social media presence, an app, anything like that, then you become the expert of that app, of app making, of tech, things like that. So find things of that nature. And before we go to Shehzad, the one last thing I'll say is, Jesse, a monster applicant, had unbelievable stats, but I don't want you to think that if you don't have the best stats that you won't make it. Of course, if the higher step score you have, the more research you have, the easier your life is going to be. But I know of multiple occasions and multiple people who had substandard step scores for ophthalmology, because their personalities were so good and because they did so well on their away rotations, they were able to overcome some of that. And they didn't get as many interviews, but they ended up matching. And so it's something to consider. And just remember that, the better score, it's obviously going to make things easier, but don't, again, self-select yourself entirely out if you don't get the exact mean score or even a little bit below, because I know of multiple people, and some people have shared presenters on this chat that they didn't have the average score, they had even below, and they matched that really great program. So something also to consider. And now, so if Shehzad is here, if you can unmute yourself. And Paul, actually, your screen is sharing. If you can unclick presenting or unmute or something, and maybe I can figure that out. But I think you're okay. Perfect. And so Shehzad, if you're here, you go ahead.
Yeah. Hey guys, I'm Shehzad Batliwala. So I am a little bit further along in my training. I'm a PGY 4, so I'm in my last year of ophthalmology residency. I'm going to be graduating here in the next 2 or 3 months, and then I am doing a fellowship in refractive surgery, so LASIK, PRK, and that type of stuff, cataracts. I'll be doing that for a year, so I can, offer perhaps a little bit of a different perspective as someone who is further along in their training. I fully agree with everything these amazing 5 other people and Harris have said so far. All of that is gold, and so I'm going to try not to ramble because everything's already been said. So I'll just kind of briefly mention my journey. So I decided on ophthalmology fairly late. I clearly remember it was January of my third year, so second semester of third year medical school, and ophthalmology matches early, so January, next year. So in 1 year I had matched, and so in that year is where everything happened. My plan for ophthalmology kind of came to fruition, and I took action. So I went to Texas College of Osteopathic Medicine in Fort Worth. No ophthalmology department, not a lot of exposure. I did well on step. I got a just for transparency's sake, I got a 251, so it was good. It wasn't your 260 or 270, but it was a decent score. And then I got like I think it was a 243 or so on step 2, so not as well, but that didn't really matter because I had already matched by then. My class rank was good as well. I had about 3 publications, 2 case reports, and 1 kind of a long form review article. So I'm not a huge fan of research. It's just one of those things that you have to kind of check the box, right? Your application, everything needs to have something in it, right? Like research, check the box, do like a couple case reports. Someone here mentioned that they had 15 publications. That's super impressive. I don't think that's necessary in ophthalmology, but you got to have something. Kind of long story short, on this side of it now, since I'm a PGY4, I've kind of was involved in the interview process and talking to interested med students and things like that came to rotate with us. You got to have something that's cool about you, right? Like Harris alluded to, and cool is like, I'm using it relatively in a very broad manner, right? So you got to have good grades, or you got to have good step scores, or you got to have a good personality, or you got to have something that's like unique and stands out about you, right? If you have all of that, you're good. You're gonna kill it. But you got to have something that really kind of makes you stand out. And so I feel that in my case, I had decent scores and all of that, but there were a couple things that I think helped me stand out. I had some special interest in some of the vision issues that astronauts have, and so I have done a little bit of work with NASA on that angle. I also have a small business background. I have some retail stores that I started prior to medical school in my previous life. And so, not everybody needs to have that, but if you have something that has taught you life lessons, mention that, right? Like make that part of your story, So I'll say that. And then the other thing is, for me, even though I had no exposure to ophthalmology, I kind of wanted to see what ophthalmology was all about. And I was like that for a lot of specialties. When I found out I did decent on my step, I wanted to try everything out. So I did urology, rotations, and I did neurosurgery, and I did ophthalmology. None of that was really available at medical school, but I just cold called local ophthalmologists and urologists and neurosurgeons, like in the community. Just call them up, say, hey, I'm a medical student, I'm interested in this field, and I'd love to come shadow you in your clinic or your OR. Make the time, show up, learn about the field, and doors kind of start opening. So yeah, anyways, and then the other thing is, you're not going to, I really think you are not going to match if you don't rotate, right, at that program as a DO. That was true when I was going through this process back in 2016, 2017. I think that's still true now. Almost everyone that has spoken here has said that they rotated at the program. So I would highly encourage you to just make a list and have 3 or 4 away rotations that you can do if possible, if your medical school allows. I did 4, and where I ended up matching, which is the Dean McGee Eye Institute in Oklahoma City, was my last away rotation. And I'm also the first DO they've taken, and that ended up happening, I feel like, because I kind of lined it up in a way to make that my last OA rotation, right? So like have a list, have some kind of, average programs that you feel like you're very competitive for, and have some programs that are kind of your reach programs. For me, the Dean McGee Institute was a reach program because they'd never taken a DO, and it's considered one of the best, one of the top programs in the country. And so that was sort of a reach program for me. And I lined it up so that the first 3 rotations, I'm getting good at ophthalmology. I'm getting good at kind of using different lenses that we have, doing a decent exam. And then come my 4th rotation, I am fully prepared to show up, right? And show them what I can do. When you go to the OA rotation, take call with the residents. I can't really emphasize that enough. Like, we want to be evaluated like the rest of the MD students, right? So show up like the rest of the ND students, right? If you are asked if you want to take call, say yes to those things. If you are asked, do you want to do a grand rounds, say yes to that. For me, I think that was key. I took call my entire month there. Like every couple days, I'd take call with the residents. And it's hard to, as a medical student, do much in ophthalmology because you don't know a whole lot, right? But there's still so much you can do, like just like even scribing and grabbing things for us. Like it's a lot of kind of scut work type stuff, but it is super, super helpful if you can make the resident's life easier while you're on call or in clinic, right? And it's a very fine balance of not getting in the way and not like kind of being annoying and not being too overbearing. You really have to navigate that balance and that line really well, and it's easier said than done. But if you can do that as a resident, that's what I'm looking for, right? Like, yeah, this guy or girl, they're sharp, they don't get in the way, they help appropriately, they're pleasant to be around, they have great scores, or if they don't have great scores, that's fine. What else do they have that make up for those lack of scores? Great personality. They've got a couple of unique things that really have taught them important lessons in life, and they're able to clearly articulate those lessons. That's all you want, right? As a resident, that's what I want in an incoming resident who I'm going to be, a senior to. So that's just kind of, just a big overview of my journey and I think what residents look for in incoming residents. And the other thing I would say is, someone had mentioned don't do a backup. So I had backups, and that's plural. I did ophthalmology was my primary, interventional radiology was my secondary, and then I did internal medicine as my tertiary backup. So I was kind of like a little neurotic in that sense, and I spent a lot of money on applications. But here's what my thought process was. I loved ophthalmology because of the technology and the chance to sort of do a private practice in it, the instant sort of gratification of surgery. Just the other day, I had a patient who had a light perception cataract, we call it, so just a white marble. Took that out, and I got him to 20/20, a couple days later. And so that type of instant gratification really is very alluring about ophthalmology. But you know what? I loved IR for a lot of the same reasons, So for me, I did not want to spend a year, if I didn't match, doing research and those types of things just to try again. I think just from a philosophical perspective, I think life is too short. I think that there isn't just one specialty that you're like born to do, right? I think there are multiple things you can enjoy doing and do really well, and make something your vocation or your career. That was my philosophy. And so I went through what I had to go through. I got different sets of letters, different personal statements, and all of that. And all that while really kind of being honest with myself and true to myself. Like, hey, do I really want to do this? Okay. And if I don't match, what else could I do? And would I be genuinely happy doing that? And my answer was yes to ophthalmology and IR. So I would just urge all of you to really, really think about what you want to do. Don't just settle for anything. Don't do something because you know, your parents told you to do something, or like society wants you to do something, or you know, you're not making an informed decision. Like really understand yourself, ask those tough questions, and figure out if this is what you want to do. Because when times get tough, it's that strong interest and passion for something that's really going to carry you through. So those are just a few words I have in this regard. And I'm an open book. I'm happy to help out in any way. Twitter, LinkedIn, got a unique name. So if you just Google me, I'll come up, and you can reach out at any time. Thanks for your time.
Thank you, Shehzad. Amazing tips. Another perspective, you know, so, you know, you can either back up apply or you don't see, and that's kind of what I mentioned earlier was you take all 6 of our experiences and you see what applies to you, what makes sense for you, what doesn't, and you kind of go from there. There's no one way to do these things. I think one thing that he mentioned that was really important is liking the bread and butter of what you're doing, because you don't get to do the sexy stuff every day. Jesse mentioned this as well, so make sure you try to get experience in your field so you're seeing the bread and butter. And we've been answering a lot of the questions in the chat box as you've been asking them. If anyone has any further questions or clarifications, go ahead and write them now. We'll wait a few minutes for those. And then otherwise, you know, we'll wrap it up, and want to thank all the people here who attended. Give us feedback, give me feedback as to what we can do to make this better. You know, we just kind of threw this together via group chat and things like that. And you know, if we can make it more structured for you, you know, I can do that. We're all kind of connected. We know each other, so we can do more specialties, more fields in the future. And just remember, it's the single accreditation system. There are new opportunities. DOs are matching at new programs every single year. The challenge being a DO is lack of access to those research departments, those letters of recommendation, that networking. And I hope the biggest takeaway you get from this is you figure out ways from us 6 how to mitigate those concerns. How do you mitigate the fact that you don't have access to research and networking and people as easily? Well, we gave you some ways to do that. Cold call departments, cold call local offices. You show up even at lunchtime and ask them if you can shadow them. Like, you know, go to grand rounds, use social media, things like that. Attend every conference you can, and try to budget the way you can. We're already in so much debt. What's another $1,000 to go to a conference? I know that sounds crazy, but that's really the way to think of it. It's an investment in yourself. We're getting some more questions here. Everyone has put in their email address, the presenters, so you can follow them afterwards. And then I'll be posting the link of the recording. I just have to figure out how to do that. And people are asking when the next panel will be. We have neurosurgery, CT, plastics, and I'm going to try to get someone from the military. And it'll be in, you know, maybe in May, most likely. And if you guys have further questions, don't hesitate to reach out to these other presenters. I think that's pretty much all the questions here. I don't see anything else.
Hey, Harris.
Yeah.
There was a question about self-selecting yourself out of residency. I'll just offer some feedback to that real quick.
Yeah,
and the
ahead.
thing is, you might not know until you rotate. Like, if you really, like I said, if you really want to rotate at a program and you have interest in there, it doesn't matter. Personally, from my perspective, my strategy, it doesn't matter if they've never had a DO. Where I did my year of research never has taken a DO, and they've never even taken a research fellow that was in that spot. But I said, I don't care. Why can't I be the first? So, like I said, don't self-select yourself out, especially if you've never seen a DO on the roster. It gives you an opportunity to show that program what a DO is. So that's my answer to that question.
Yeah, you know, a lot of times what happens is a program has taken a DO before, and then the DOs just flood that program, and they get 10 or 15 or 20 students trying to do an OA there, and it's actually a pretty strategic to go to a program that's never had one. I actually recommend you pursue programs that have never taken a DO, especially in this era. These are the few years, these next 5-6 years, where you can get away with that, because I think it's going to get to a point where we'll end up having someone at pretty much every program just because of the single accreditation process. So this is prime time for you to take advantage of that newness.
Yeah, I agree. I think that's something that actually all of us have kind of highlighted, is that, you know, we all had the mentality of like, hey, why can't I be the first, right? So like, you got to have that mentality too. Don't just try to follow, but be that trailblazer, you know? Don't be afraid to go out there and be like, hey, you know, they haven't taken a DO. That's okay. Let me go here. So definitely do that.
And and someone is asking if you have to be above the averages as compared to MDs. No, not necessarily. You don't have to. You can. I know of people personally that were below the averages of given programs, but because they did well in their away rotation, because they did well in terms of their interaction with people and their I said away performance already, but your personality and the way you interact with people can overcome a lot. But at the same time, of course, if you have better stats, more research, it's going to make life easier for you. But it doesn't mean necessarily that that's what you need to focus on entirely.
To second that, I don't even meet the step 1 cutoff for my program, and I'm there. So don't pay attention to that. Like, seriously. And there are people with 250s, 260s that don't match all the time. It's because no one knows who they are. So if you're competitive orthopedic wise, I would just say don't say you're competitive, like, because you'll be content. So my challenge for us as DOs, even if you have the scores, find ways to just stay hungry, because at the end of the day, if you have those scores and nobody knows who you are when you're applying, it doesn't really help. So I guess what I'm trying to say is, your scores don't matter. It's more important to have mentors and advocates that are fighting for your application. It's part of the process to get the scores and all that, etc. But I think it's our challenge as DOs to really branch out and let people know who we are. And from the 6 people on this call, I mean, it's just to hope and motivation to show you guys that you guys can do that. But we didn't do it alone, and it wasn't just our scores that got us here. Like he said, what is cool about you? Like, what is it other than grades that make you a person? I was always the person that I wanted people to know my story. I was born in Africa, but I was also a good person. And the feedback that I got from my letters is, you're someone that people always wanted to help out. And that was a constant theme in all your letters of recommendation. So scores are important, but just don't get caught up in the hoopla of step 1, 250, 240, all that stuff.
Yeah, I agree.
Someone's asking about using SDN as a resource. You may see me on SDN every now and then, but SDN, I think, is not the worst thing ever, but there's a bunch of self-hating DOs on SDN, which I don't know if they're allopathic agents or obviously that's a joke, or what they are, but take it with a grain of salt, because a lot of those people are eggs behind fake profiles and things like that. But sometimes, and a lot of times, they have good knowledge and good pieces to offer you. So it's not the end of the world. Someone's asking, how can we look up conferences to attend? If any other presenter has any thoughts on that. For me, I would just ask around or just Google it, and a lot of times you'll find different resources. One big point I just realized now, thankfully there's a recording, is use your DO societies. It's a huge point that I forgot to bring up. American Osteopathic College of Surgery, American Osteopathic College of Ophthalmology and Head and Neck Surgeries. These are national colleges, and all the program directors of those former AOA programs that are now ACGME, they are all well in touch with those individuals. So it's a very small community, a very intimate community, and people know each other to an even greater extent. So in ophthalmology, those 5 or 6 programs that are now ACGME, the American Osteopathic College of Ophthalmology, they know those people intimately for decades. So that's a huge in. Also, these colleges have national conferences where you can get that research presentation on your resume, a poster or a presentation. The American Osteopathic College of Ophthalmology and Head and Neck Surgery, they even give out $2,000, $1,500, $1,000 gift or reward rather if you place 1, 2, or 3 in their research. So use your DO specific specialty colleges to get networking at those former DO programs, and they have networking in other programs too, and for research experiences to pump up your research. And Victoria's asking, if you want to do research here, where do you look up for programs? That's a question. If Jesse or Temi are here still, they could answer that, about how do you find research programs.
Hey Victoria, I got your email. I'll respond to you shortly. But a website is OrthoBullets or OrthoGate. Sorry, you can search research fellowship on orthogate.com and you should be able to find some. But I'll respond to your message shortly.
And someone is mentioning against NRMP, and remember, NRMP, big data is always good because you can get trends. But because our sample size of DOs is already so small, and then those of us that apply to surgical subspecialties is small, because the emphasis in our field is primary care, which is also great. Because of that small sample size, the data is all over the place. 15, 10, 7, 20%, even 30% fluctuations in match rate from year to year. So don't look at that number of match to, you know, ophthalmology or ENT and then get disheartened and think that, oh, I have a 20% chance. It's because the sample size is so small, you can't gather too much from that. You should consider it, but don't become obsessed over those numbers. Let's see if there's any other questions that any presenter sees. And even the DO focused NRMP, the issue still is that the sample size is very small, so it's hard to, you know, utilize that too much and get too much meaningful information from it.
Harris, there's a question about a general surgeon. You should get Robin for that session.
Oh yeah, so we have one of our classmates. She's an absolute legend. She's at Minnesota. Where Temi?
Yeah, University of Minnesota, general surgery.
So I made a note of that also. So next one we'll have military and general surgery are two things I'll have for the next one, military and general surgery. And then let's see, any other question? Yeah, because general surgery is amazing as well, so we definitely would want that there. And you know, another thing that Temi and I, you know, we might be working on is creating an app, a for-profit app to line up our pockets. No, I'm just kidding. We're gonna make an app that will maybe link you guys up with mentors in the DO world. You know, it's something that, you know, we're working on, and we'll release that out on our Twitter as well, so you guys can, if you're interested in this field or field A, B, or C, you can just put that in, and then we can link you with mentor in field A, B, or C. And separately, we can also do these for dermatology, rad-onc, interventional radiology. If that's something that people are interested in, we can do that as well. Again, the timing, it's going to be dependent on, you know, when we can make it happen. It could be May or June. Any other questions that anyone sees or concerns? I know everyone's disappointed they couldn't see Temi, you know, the big handsome guy matching at University of Washington. He may be in Calvin Klein commercials soon, so you can see him there. Should I take up underwater basket weaving to set myself? You know, honestly, underwater basket weaving sounds like a joke, but if you can set yourself apart using anything, it's good. I was in a movie my first year of medical school as an extra, and it was a hilarious thing. I did it for fun with my roommates. I put it on my application, and every single interview it was brought up that I was in a movie. It was about you know, Afghanistan or something, so I was like a stereotypical brown guy in the back. But you know, so anything unique. It doesn't have to be. You don't have to cure cancer and you know, solve the COVID-19 pandemic. That's not the threshold of doing something unique. It can be something you know, silly or small or unique or not unique but fun. You know, it doesn't have to be something crazy. Gabby is mentioning here that everyone asked about her dog. You know, you want to find identifying characteristics. One thing for me was being in New Mexico, same with Temi. That in and of itself is unique. There's only 2 medical schools in New Mexico, so I definitely own that. I'm from New Mexico. Have you seen the show Breaking Bad? Have you ever had green chili? Right? So these are things that were unique. Let's see, anything else? We'll go another couple of minutes here. We still have about 100 people here. And it really points to the need for this type of material. I mean, this was just through Twitter. We were able to reach this many people. We'll go one more minute. If we get any other questions, we'll answer those. If not, everyone can follow me at Dr. Harris Lakers, and I'll put the recording up as soon as I can once I figure that out. And we'll have information for the next panel.
Be cautious, guys. If you're not a Lakers fan, I would advise against following Harris on Twitter. Just be careful. That's it.
Yeah, I'm definitely gonna hit you with the Lakers fan.
But the joke is on you, because there's no such thing as a basketball fan who's not a Lakers fan, right, Harris?
That's right, dude. I don't recognize you as a human being if you're not a Lakers fan.
And
all right, guys.
Kobe. Just had to throw that in there.
Thank you. I appreciate that. All right, guys. We're gonna call it. I'm gonna hopefully figure out how to upload this. And thank you all for coming. Thank you to the presenters. And we'll see you next time.